The number of children being hospitalized with COVID-19 has soared to record highs in the U.S., a worrying trend experts believe is driven by low vaccination rates and the contagious Omicron variant and could be worsened by unique complications caused by the way the strain infects the lungs. There is still a lot to understand about Omicron and its impact on children, but it's possible the variant can cause unique complications not present with other coronavirus strains. Recent research suggests the variant is less successful than other strains at infecting lung cells, keeping instead to the upper airways. This is possibly why it is so infectious, but also a good thing in terms of disease severity, potentially meaning milder illness. For children, however, this change could mean more serious illness, as they are much more vulnerable to complications from upper respiratory conditions than adults, and the outcomes can be much more serious. With hospital cases spiking, reports are emerging from pediatric units of young, COVID-positive children presenting with these kinds of respiratory complications. Around 39,000 children were hospitalized during the 2019 flu season, according to CDC estimates. The agency estimated approximately 10 million children had symptomatic flu infections during that period. The American Academy of Pediatrics reported some 7.9 million children have tested positive for COVID-19 during the pandemic, more than 1 in 10 U.S. children, and, according to CDC data from August 2020, the earliest available, some 80,000 children have been admitted to hospitals with COVID-19 or flu claimed the lives of 372 children in the 2019 season. Since the start of the pandemic, 1,046 children have died with COVID-19. Vaccines are crucial for reducing the risk to children, Adalja said, noting they are generally spared from severe disease. Greater vaccination among adults will mean the virus poses less of a threat to unvaccinated children, Adalja added, and the more that children are vaccinated, the less children have a much lower chance of developing severe disease from COVID-19 than adults, but can and do develop life-threatening illness. Despite the availability of vaccines, uptake among children has slowed after strong early demand. Polling indicates many parents are also unwilling or unsure about vaccinating their children, and the new variant does not seem to be persuading many vaccine holdouts to change their mind. COVID-19 hospitalization surge among U.S. children spurs new Omicron concerns, Reuters. COVID hospitalizations among U.S. children soar as schools under pressure, Guardian breaching the barrier that protects children from serious COVID-19 related disease, Forbes record number of children hospitalized.